Hi, my name is Heather Waldschmidt. I'm a Master's of Athletic Training student at Texas Lutheran University, and this video is going to be over the effects of exercise on drug absorption. So if you're new to pharmacology and you don't have a deep understanding of how exercise will affect each specific medication that your patient might be taking, this infographic can be super helpful for you to help determine that even without knowing the specifics about each drug. So when we look at exercise as a whole and how it affects the body, we know that it affects the blood flow in our body, our respiration rate, and the fluid volume of our body. The 4 common administration routes that you may or may not be familiar with for medication are enteral, which is also known as oral. An example of that would be a pill. We also have parenteral, with an example being a shot or intravenous fluids. We also have topical, which would be like an antibiotic cream. And then we also have respiratory, with an example being a rescue inhaler for someone with asthma. So when we look at how each of these are affected by exercise, if we start with oral medication, we know that oral meds will normally take anywhere from 30 minutes to an hour to be fully absorbed by the body if we're not exercising. And so when we look at the effects of exercise, we know that it will increase the blood flow to our muscles and skin, which in turn decreases the amount of blood flow to our digestive system, which will slow it down and decrease the absorption rate of those medications. When we look at parenteral, if we're looking at a shot, the shot goes directly into the muscle, which will then take it in and get it into the bloodstream. And so if we're looking at the effects of exercise, we know that the muscle and skin blood flow is increased during exercise, so that drug that will normally be absorbed pretty quickly will be absorbed even quicker through the bloodstream that way. When we're looking at topical medications, it can vary on what type of medication it is as to how fast it is normally absorbed in the body. But when we're looking at the blood flow of our body, the increase to the muscle and the skin will increase the absorption rate of that medication. But it's also affected by the fluid volume in our body. So when we sweat, our fluid volume goes down because we're expelling all of that water, and it can increase the concentration of electrolytes and the other things that are naturally in our body. So when we introduce a topical drug into that is being absorbed, the concentration of that drug will be much higher at that point in time during exercise than it would be if the patient was not exercising and we gave them a topical medication. And then when we look at respiratory, we know that the lungs take in medication pretty quickly because the red blood cells are right there taking in oxygen as well as that medication. And when we increase our respiration rate, the blood flow is also increased through our heart, and so that medication that we are absorbing through the alveoli in the lungs is going to be distributed much faster with the increased respiration rate than even just a normal respiration rates. So the effects that these mechanisms have on exercise in our body, when we're looking at that clinically, when we're determining if we should give a patient NSAIDs or like Tylenol before practice or a game, we can think about how oral medications are affected by exercise, and we might be able to educate our patients on when the right time is to take medication, because in a lot of sports like softball and baseball specifically, they usually at TLU will take medications before practice just because that's part of their habit. That's how they have been doing it for several months, even years, as their athletic career has gone on, and so that's what they're used to. But we might be able to educate them on the fact that that medication is not actually going to get absorbed while you're exercising as fast as you think it probably is. It's going to be slowed down significantly because of the decrease in blood flow to the digestive system. So we might be able to change their habits in taking medication, as well as educate them. And that goes for any of the types of administration. As athletic trainers, we usually deal with oral medication or topical medication, so knowing how these are affected by exercise can determine when we want to give an athlete medication and when we think it is appropriate. And so I hope that this video has been helpful for you, and that you have been educated on the basics of exercise and drug absorption.